Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, Chennai, the continuing CME medical education program and especially health awareness program for the public, and based on that, the topic of today is on the facets of epilepsy, which I had already spoken part 1, 2 and 3. This is the part 4. This is the highlighting the causes of epilepsy. You all have seen a person with a fit. Now, most important thing one has to understand is epilepsy is a symptom of an underlying disorder like fever. Fever is also a symptom of an underlying disorder, like it can be a bacterial infection or a viral infection or a fungal, which we will have to identify. Similarly, epilepsy is a symptom of an underlying disorder. And when you are going to investigate a person with epilepsy by using the modern diagnostic tools like CT scan and MRI, and when the picture comes, you should know what exactly you are looking for. For that, you should know the causes of epilepsy. Sometimes you find 50 to 60 or even 75% may be idiopathic, where you do not know a cause, but there might be other causes that are producing epilepsy, for which you should understand. So, if the eye does not see what the mind does not know. So, when you are looking at the CT and MRI, you should know what you are looking for. So, for that you should understand what are the causes of epilepsy. It can be by birth. Some can develop epilepsy like congenital abnormalities or chromosomal abnormalities, or it can be antenatal factors where a mother had infection, anoxia, then perinatal as the child is being born, birth trauma, asphyxia neonatorum. Genetic causes can be like voltage gated channel mutations, sodium, potassium, chloride, any one of this can in fact produce problem. Infectious disorders like meningitis, epidural or subdural abscess, brain abscess, encephalitis, that is a viral infection of the brain. Or it can be other toxic factors like inorganic substances, carbon monoxide, metallic substances like lead, mercury, organic substances like alcohol per se can induce seizures, especially alcohol withdrawal. Drugs can also induce, and drug withdrawing can also produce seizures. Allergic disorders, especially ingestion of foreign proteins. Then trauma can produce seizures. Acute craniocerebral injuries, subdural or epidural hematomas, post-traumatic meningocerebral cataract, that is a gliotic scar after a head injury. Suppose there is a contusion in the brain, there is a clot that heals and leaves a scar, that is a post-traumatic meningocerebral cicatrix, anoxia or hypoxia. Circulatory other disturbances like subarachnoid hemorrhage, venous sinus thrombosis, encephalomalacias due to thrombosis, embolism or hemorrhage. Hypertension, when it is very high, can produce encephalopathy. Cardiac arrhythmias can produce problem. Neoplasms, brain tumors can produce cysts. It can be intracranial like astrocytomas, gliomas, meningiomas, lymphoma, leukemia. Then blood vessel tumors and vascular malformations can produce. Then heredofamilial diseases like neurofibromatosis, tuberous sclerosis, Sturge-Weber syndrome, etc. can also produce seizures. Then there are a whole lot of drugs also which can produce seizures. These are all some of the causes for seizures. These causes should be there in mind. So, when you look or when you are going to investigate or when you are getting some investigation results, you should know whether these causes are there or not producing that seizures. So, it is very, very important that you should know the causes of epilepsy for you to diagnose what is the one that produced that epilepsy. Very, very important. Thank you very much.